Yeah, absolutely. So I think on some of the challenges, we think about it in three major domains, which is basically the why, what, and how of digital transformation of health. And for AI to scale in health, we need to address the why, what, and the how. I think on the why, it's this need, as I mentioned, to build collective will. So leaders and organizations need to, invest more effort into enabling AI-driven transformation of health. So there's already a lot of energy going in, but we need to be more and put more concerted effort and thinking into how to actually address that. And that requires a lot of will and belief from the leaders in the ecosystem. The challenge is that AI and health is very complex, very challenging for leaders and policymakers to actually address, and the landscape is very fragmented. So we need to more clearly define the value of it, and we need to inspire the ecosystem to take action. Second, on the what, is that we actually need to develop the enabling environment. So the technical choices that are being made are not necessarily aligning with the strategic vision for better health. We need, greater digital and AI literacy for healthcare across decision makers, practitioners, government, et cetera. So everyone needs to really have a really good understanding of how AI is going to impact this sector, and we need that expertise. We also need better digital public infrastructure, so that underlying architecture, that common architecture that will allow everyone to benefit from AI in health. And we need harmonized blueprints for building the right that right technological infrastructure, and also the markets and operating models for AI and health. So how do I get reimbursed? How do we exchange data in the right way, make it interoperable, standardized, et cetera. So we need to create a ecosystem that operates more smoothly and is de-risked. We need to remove the risk and ambiguity from the ecosystem. And then lastly, if you have the collective will and you have the enabling environment, the last piece is really the how. So how do we actually make this happen? What are the steps needed? And there we need to chart a clear path. So there right now are unclear paths to scale. In this space of AI and health, there are a lack of playbooks for multi-sectoral collaboration or global collaboration. So this means, wheels are being reinvented around the world. There are a lot of silos, a lot of inefficiency. We need these clear roadmaps for systems change with AI and health. And so there are various opportunities that have come to mind, but there are some calls to action for leaders that the World Economic Forum and partners are working on, which is, for example, to compete on services while cooperating on infrastructure. So can we agree on the common ground for this AI-enabled healthcare, and then work on differentiating ourselves among the key services that we're going to deliver? Another is around data. Can we move to more of a network economy in data, where we find ways to collaborate using health data and other sources of data, while maintaining local agency and all the right standards in place. So there are a lot of, for example, federated learning approaches that are emerging for health data and health AI, which seem to be very, very promising, and we should work on that. And another one is for example, proactively building trust. So what are those models where innovators and industry can build public trust and build trust with government and regulators that the innovation they're doing in AI and health is safe and effective and better than the alternatives. And so we see, for example, self-governance models emerging where companies are committing to certain guidelines and standards. And we see also collective action like the Coalition for Health AI in the US, which is working on assurance of AI tools in the health sector. And just to comment briefly on a regional aspect, I think it's very interesting. There's a lot of nuances and differences between regions. In the Middle East, I think there's been very rapid advancement. You see a lot of cutting edge innovation being developed, both from the private sector, but also government is taking a key role, really supporting this transformation and kind of being very proactive, which is a good thing. Another example that's a bit different would be India, for example. India in health, I think, is taking a leading role on defining the digital public infrastructure, such as the Ayushman Bharat digital mission. So creating, national digital health architecture, the right health IDs, the data exchange, and all of that. And India is very unique because, it represents a huge potential to scale. So it could be one of perhaps the only place in the world where an AI or a digital health solution could, easily reach, say, 100 million people. And there are very few places in the world where you can do that. And then lastly, one other I would highlight is Africa. So there, when we talk about leapfrog, there's really the potential, again, to leapfrog. There's such a huge gap in healthcare workforce capacity, especially in Africa. And, maybe can we see something similar to what happened with, say, mobile money, where you rapidly, moved past traditional phases of banking and moved straight to purely digital service delivery? And can we see similar approaches like that in healthcare? That would be a question that I would pose. So, yeah, those are some of the challenges and opportunities and the regional differentiation that we've seen.